Welcome to the recorded version of Building Dementia-Capable Communities, an Orange County, North Carolina case study from July 19, 2017, part of the National Alzheimer's and Dementia Resource Center webinar series, sponsored by the Administration for Community Living.
Thanks, Steve. Welcome to the webinar today, everyone, on Orange County Department on Aging's Dementia Capable Businesses Initiative. In this webinar series, the Administration for Community Living's National Alzheimer's and Dementia Resource Center has partnered with the American Society on Aging. We're really pleased to have all of you in attendance today. And before we start the presentations, Erin Long of the Administration for Community Living will provide a brief welcome.
Hi, everyone. I just wanted to say thank you for taking the time out of your busy schedules to attend our webinar with Orange County. They're doing wonderful work in the dementia-capable community field, and we're very excited to hear about their successes and look forward to any feedback you might have on this topic or any other topics that we have on our webinar series. So thanks again to everyone for attending, and thank you so much to our presenters for being willing to share information about their programs. So back to you, Sari.
Thanks, Erin. So for today's webinar, we'll hear from Mary Fraser and Marie Dagger. Mary Fraser is the Aging Transitions Program Administrator for the Orange County Department on Aging, and she serves as the Project Director for this ADI SSS grant project you'll be hearing about today, Orange County Cares, Caregiver Awareness, Respite, Education, and Support. Marie Dagger is the Training Coordinator for this ADI SSS grant, and we're pleased to have both of them with us today. So Mary and Marie, I will turn the floor over to you.
Great. Thanks for the introduction, Sari. As you said, I'm Mary Fraser, and Marie and I will take turns talking to you today. I am the Aging Transitions Unit Administrator for the Orange County Department on Aging, and also the Project Director for our ACL ADI SSI grant called OT Cares. And again, that stands for Caregiver Awareness, Respite, Education, and Support. So let's start off with a little context. Who are we? First of all, Orange County is a medium-sized county in central North Carolina with a population of about 140,000 people. Its largest town, Chapel Hill, is the home of the University of North Carolina. So we're lucky to have many professional and medical resources nearby. However, the Chapel Hill area represents less than half of the population of Orange County. The rest is located in a small town, Hillsborough, and throughout many miles of rural farmland. Orange County is truly diverse in really every way, economically, racially, ethnically, and educational attainment. The largest minority group is African American at about 15%, with growing Spanish and Mandarin-speaking populations. And similar to many places across the nation, Orange County is getting older and older. In fact, there are now more people over 60 living in our county than there are children in schools. Marie and I work for the Department on Aging, which is a unit of county government, much like the Department of Social Services, the Health Department, the Housing Department, etc., but devoted solely to older adults. We receive federal Older Americans Act and Home and Community Block Grant funds through our regional AAA organization, as well as a general amount of county funding targeted for aging and place supports for older residents. In place since the early 1980s, the Department on Aging has become the hub of aging-related services in our county over the years. We host 2 nationally accredited senior centers, which attract about 600 people a day for wellness activities and aging in place services. We applied for the ACL grant opportunity because we recognized the need to improve and expand our services to persons living with Alzheimer's disease and related dementias and their caregivers. More and more people were coming to us for help and support, and we knew that although we provide a broad range of aging and place support services, we were going to need more specialized services for this population, and we were going to need more community partners. We wanted to enhance our ability to make Orange County a truly dementia-capable community. This brings us to the issue. What is the difference between a dementia-capable and a dementia-friendly community? Can one be both? We think the answer is a resounding yes, that there is nothing that is incompatible between the two. Dementia Capable seems to focus more strongly on bringing medical professionals together with community-based services into a sensitive and coordinated system of care. It's concerned with dementia training at many levels, especially at the provider level. Where Dementia Friendly focuses a bit more directly on community education and acceptance, and modifications to the living and social environment to ensure that persons with dementia and their families can enjoy a normal life in their communities for as long as possible. Dementia Friendly may more likely refer to a specific location, such as a dementia-friendly hospital or a dementia-friendly business. Regardless, we think that we want to be both, dementia capable and dementia friendly. We want to focus on provider education and coordination and set up a range of services and supports that are tailored to individual need. At the same time, we want to provide community education about dementia to promote acceptance and understanding and to make our social environment in Orange County dementia friendly. So we focused our project on a set of core elements that embrace our desire to be both dementia capable and dementia friendly. We want to raise awareness and transform attitudes with the general public for sure, but also with the medical and professional caregiving community. We want to create support options that foster quality of life. We know that we need to work together as a community to make sure that persons with ADRD, which is Alzheimer's disease and related dementias, and their caregivers have safe and welcoming places to live and socialize. We want to support caregivers as much as possible so they can keep their families together as long as they can, and to make alternate plans when change seems necessary. And finally, we want to promote opportunities for participation in community life for both the person with dementia and their caregivers to avoid withdrawal and social isolation. Specifically, we developed a three-prong approach for our OC Cares project. At the individual level, we hope to create a wide range or a menu of services and supports that caregivers can choose from as their journey progresses. We've come to learn that families living with dementia are all different. Their understanding of the disease is different, and their readiness to accept outside help varies due to a host of reasons. Instead of assuming that caregivers will need certain services at certain stages of the disease, we've tried to provide a broad range of services and allow the caregiver dyad to determine what they want to take advantage of. We currently provide education and consultation sessions, and for some people, that's all they want. But we also can provide a variety of respite options and social opportunities, as well as specific trainings in behavior management and activity engagement. At the provider level, we're focused on provider education mostly. All of the staff here have completed the Alzheimer's Foundation Dementia Specialist Care Partner certification, and we promote this among our partner organizations. As part of our ACL grant, however, we've been able to provide some free dementia training to direct care workers targeting communication and engagement skills. At the community level, we have two initiatives. The first is a three-part dementia education series offered monthly, open to the public, to provide basic information about what Alzheimer's disease is and how it differs from other related dementias, how they frequently progress, and the resources available to help both the person with dementia and the caregiver. In addition to the general public, this educational series is specifically targeted to caregivers of persons newly diagnosed with a cognitive impairment, as they often don't get a lot of information from their medical provider about what to expect or how to get community support. The second initiative is our dementia-friendly business campaign, which we'll provide much more information on during the rest of the webinar. We hope that participation in the dementia-friendly business campaign will increase knowledge and awareness about dementia across many sectors within our county, as well as motivate individuals to make our community a welcoming place for persons with dementia and their caregivers. But before we begin describing our dementia-friendly business campaign, we just want to provide this disclaimer. There is no real blueprint for doing this. This is just how we did it in Orange County. We believe that each community has to find its own way to make it happen. There are many places to begin. but it's probably wisest to start where you have experience or resources, or most of all, opportunity. This is our logo. We created it ourselves. The flowers are reminiscent of the cornflower, which is the Dementia Friends symbol from the UK. We wanted our own brand, but also wanted it to be tied in some way to the larger movement. We have used this logo and we turned it into a sticker that can be placed on the storefronts of local businesses who complete our training program as a symbol of their support and a beacon to caregivers looking to conduct business in a welcoming and supportive environment. These are the goals of our Dementia-Friendly Business campaign. Pretty straightforward. To reduce stigma associated with dementia, to reduce barriers to prevent people from dementia from engaging in community activities, and to encourage those with dementia to continue to participate in activities that they did before. To create safe environments, both public and in the home, and to improve the quality of life for those living with dementia. So how did we begin? The idea arose from a member of our board of advisors who happened also to be a member of one of our local Rotary clubs. This person, Lorenzo Mejia, happens to know a lot about dementia, both professionally and personally. He thought that the Rotary Club could do something special in our community to make life better for persons living with this disease. He had learned about the dementia-friendly movement in Europe. So he came to the Department on Aging to see if we would partner with the Rotary to support a dementia-friendly business campaign here in Orange County, North Carolina. Well, we said yes to this project, and we did that even before we got the ACL grant. We really didn't have much money. The Rotary Club donated funds for our initial marketing materials and our storefront stickers that you saw as our logo. And we created our own training video using Lorenzo's iPhone, using publicly available training vignettes and interviews with local caregivers. 9 Rotary members offered their businesses to pilot our training. They gave us great feedback on content and format. They were great partners. Once the pilot period was over, we were ready to go public. We wanted to make a big splash and get a lot of community attention and support right at the start. So we decided to hold a press conference. Now, I have to tell you, this is not a usual practice for the Department on Aging. We had never done anything like that before. But our business partners were encouraging, so we tried it. We knew that to get attention from the media, we would need to find a well-known community champion to lead the way. So this is where opportunity really came to play. That we approached the Dean Smith family of Tar Heel basketball fame to support this effort. Dean Smith's wife, Linnea, agreed to speak out at this event to support the needs of caregivers and persons living with dementia in our community as they had had this experience. She asked for businesses to support the initiative. This press conference gave us a good start, but we still had to recruit each of our business partners one at a time. I'm going to turn the rest of this discussion over to Marie Dagger now, who is the training specialist for our OC Cares project and coordinator of the Dementia Friendly Business Initiative. One of her first tasks on day one was to recruit more business partners into the project.
Thank you very much, Mary. And I am just going to start by telling you guys about the handful of requirements that we do have for an organization to become a dementia-friendly partner. These principles really do help us maintain consistency across the board in terms of what it does mean to be an Orange County dementia-friendly partner. So the first thing is that we do request there be an Orange County connection. We prefer the business location to be within county lines, but we also consider organizations that routinely serve residents even if they're outside of the county. For example, the offices of one of the local moving companies that we trained are outside of the county lines, but they regularly serve residents that are within our local towns. And this is really because we have gotten requests from businesses all around in our community, and just in terms of our capability of serving each of these businesses as best as we're able, we really have to draw the line somewhere on what our capability is to meet each business's needs. We also ask that at least 50% of public-facing staff go through and receive this training. We feel this is incredibly important for just maintaining that idea of a dementia-friendly organization. Having that 50% mark really increases the chances that when a person or a family living with dementia enters into a business, that the person they're working with there really does have this increased awareness and sensitivity to their whole situation. We also have requests about group size. The training is very discussion-based, and the ideal group size is right around a dozen people. We have gone as small as 2 or 3 and up to about 20 people, but with either a smaller or a larger group than that, the discussion gets to be really difficult. In a 1 or a 2-person situation, each person feels like they have to have all of the answers to all the questions we're talking about. And in a larger group, we figured out that nobody really wants to talk anymore or share any of their insights. But again, we do try to be as flexible as we possibly can with business owners and managers, even coming back to a location multiple times as needed to make sure that we're, touching as many of their staff members as we really can. And at the end of each training, each participant is asked to brainstorm a few dementia-friendly ideas that they would like to see in their workplace. These ideas can be suggestions to maybe continue a specific practice that they have, or make a slight change in the way they're doing something, or even larger conceptual changes to their business. We talk about some of these out loud during the discussion, but then we also ask the group participants to write down these suggestions and ideas. And then after the training, myself and some of my other volunteers, we look at these ideas and we develop goals for each business from these brainstormed ideas of each business's employees. And there's no requirements about any of these goals. We just ask that businesses keep them in mind over the year to come. And then at the 1-year mark, we do check back in with each business to see if there have been any changes made in relation to these goals and what kind of impact this has had on themselves or their customers. And I'm actually going to go over some of that 1-year feedback in just a few minutes. So to become a dementia-friendly partner, we do ask that each organization participates in our 60 to 90-minute training. The training really does vary in time depending on how chatty each group is and how many questions they ask, what's going on in their own lives, and what experiences they've had. We try and touch on each one of those ideas for each business. But the backbone of the training is a 20-minute training video, like Mary said, created by our partner at the Rotary Club. This video does share some general information about dementia, including common signs, common symptoms. It shows the experiences of people living in our community with dementia, both caregivers, and we're very grateful to have the voice of a person with a diagnosis in our video, sharing their experiences in their own words. And then we also have a handful of vignettes, which we use with permission from Alzheimer's Australia. And if you're interested in seeing the video itself, you can view it on our website, which is shown on the screen right there in front of you, and that's dforangecounty.org. And so beyond the main video portion of the training, the majority of our time is spent in discussion. We always spend a few minutes at the beginning with introductions, just understanding the roles of each person in the business setting, so we can really hope to gain an understanding of any personal connections that they might have with somebody with dementia. And on average, about half the room does have a personal connection, and that doesn't even count the number of times somebody might come up at the end of a training and say, well, now that I have all this information, I'm really wondering about this neighbor or this friend or this relative. So it really sparks this interest and this understanding and awareness of what's going on dementia-related in the world around folks. And then we also spend a significant amount of time discussing each of the vignettes in the video. And I really do think the majority of the learning happens during each of these discussions. The training facilitators ask questions of the group based on what happens in each of the vignettes, and then guides the group to realizing some of the environmental factors and communication strategies that are affecting the situation. For example, in one of the vignettes that we use, there's a situation where there's a gentleman in a store and there's some loud noises over a PA system and lots of people rushing and walking by, and there's a sales clerk who's talking incredibly quickly and just trying to make a sale. And then the gentleman just appears to be more and more confused as that situation goes forward. So through the discussion that we facilitate, we help the group realize and come to the conclusion of how each of these factors are affecting the situation, and how it could be done differently, and maybe how those strategies could apply to their specific work environment. And like I said, these discussions can take anywhere between 20 minutes and 60 minutes, really, depending on the group and where their specific needs take us. We try to be, again, as flexible as we can to meet these needs and answer any of the questions they have about dementia, whether that be specifically in their work environment, or there are those times when people ask questions related to more personal situations in their lives. So beyond the standard training, we have received requests from several organizations that we say they can benefit from the dementia-friendly trainings, but they typically encounter their patrons in a different way than typical businesses do. For example, our local bus system was, and is again this summer actually, very interested in having their bus drivers and dispatchers trained. But our standard conversation around a person with dementia in a retail environment really didn't seem to be the best approach to that scenario. So we've modified our standard training a little bit using a different scene from the Alzheimer's Australia vignettes that's transportation related. So in the one that we added, there's a situation with a taxi driver picking up an elderly woman for a doctor's appointment to take her home, and along the way the elderly woman becomes alarmed at the route they're taking and how home doesn't look exactly right for her, and how the taxi driver deals with that situation. And we know this situation isn't an exact match for our bus drivers and dispatchers, but it's really been a wonderful point to start a discussion and talk around this issue. Because nearly everybody can relate to the situation in some way, or it reminds them of something that has happened in the past or they could foresee happening in the future. We took a fairly similar approach in our fire and emergency services departments. We tailored the presentation to better fit with their higher level of knowledge of the signs and symptoms, and spent more time with vignettes that were emergency related. For example, we have one that depicts an emergency evacuation situation, where the emergency officers had to help everyone in a neighborhood evacuate from their homes in the middle of a storm. And there was an elderly woman very confused by the whole situation. She was actually asking about the water, if they were there about the water, and then if they were there about the water bill, and then she was worried about her cat, who happened to have a very human-sounding name. And so we had a really good discussion about all the different kinds, probably not all, but a lot of the different things you can keep in mind in emergency-type situations. And then we also took that opportunity to start talking about collaborations between local agencies, making sure that the emergency personnel are aware of what kinds of services are available through us at the Department on Aging, so that then we as a community can better serve the families who may be having these routine emergencies with the home. And our current next step in individualized trainings is to design a training for faith communities. We've had several requests from both congregations and families, so we're in the process right now of discovering what these needs are for both congregation members and clergy and lay leaders. So outcomes. To date, we have completed 85 different trainings with more than 650 different individuals. We currently have 60 official dementia-friendly partners across the community, and this includes banks, law offices, county government departments, pharmacies, a moving company. We do have 11 more trainings on the books right now, and one of my favorite, or one of the most interesting statistics, I think, is that in a post-training survey, 95% of trainees said that this topic is something that's important to them, which to me really speaks about how this training is able to hopefully reduce some of that stigma that we're seeing in our communities. So of our 60 dementia-friendly partners, the majority are in financial services. We have had a lot of interest from banks and financial planners and CPAs about how they can better serve their clients with dementia. And, just a caveat here, it's not to say that we try to tell them how to do their jobs. We just try to give them a few more tools in their toolbox to have positive interactions and keep in mind other things related to that condition. And really just start conversations around challenging issues. And these challenging issues may be ones that nobody really has the answers to yet. We're really just trying to start these conversations among, within each of these institutions and hopefully among the institutions as well. Our second most common area is actually our county departments. And that's because we're lucky enough that our county manager requested that all of the public-facing county offices go through the training. And it's been really amazing to have this support from the county manager and be able to, reach so many of our, co-offices within the county as well. So other outcomes in terms of those one-year follow-ups I mentioned a minute ago. So far, we have completed these one-year follow-ups with 16 of our 60 organizations. So we've got some good preliminary data about the effect this training has had on businesses. So, percentages only mean so much when it's 16 respondents, but 93% of respondents said that they have been using the elements of the dementia-friendly training. Reporting that has been beneficial to both staff and customers, and the ideas that we presented were practical and easy to implement. And a little over half of respondents said that they have changed their practices because of these training. These changes can include increases in awareness and sensitivity, having more positive interactions overall, having more tools and techniques when serving someone who has dementia. And there have also been businesses who have integrated these ideas into their staff orientation trainings, or who use this dementia-friendly partnership in some of their marketing campaigns. And in sharing specific customer encounters, businesses reported improved customer interactions and being able to better identify a person who might need more assistance. Another thing that feels confirming of what we're doing is that 15 out of the 60 organizations said yes, that they definitely want us to come back so they can renew their partnership for another 2 years. And quite a few have actually asked us to come back at the 1-year mark as well, just to make sure that their new staff or staff members who may have missed it the first time around and get to have the training as well. The library, for one, actually reached out to us well before their 1-year mark, just because they were so enthusiastic about the topic and the information, and they're really working towards putting some good changes into place. So in terms of our ongoing challenges, marketing and recruitment has definitely been an unexpected challenge for us, especially as we're offering a free training to any business in our community. We've tried marketing through flyers, going door to door, using social media. We actually also ran a radio ad campaign for a few months to gather more interest from businesses, but it was also surprisingly unsuccessful. From that attempt, though, we did gain a very positive relationship with our local radio station, who will now give an on-air shout-out for every new business that becomes trained. Overall, though, I do have to say our best method to bring new businesses on board has been through a personal connection. Either the business owner knows someone on our team or knows of the challenges one of their customers is going through, or in quite a few cases, an owner or a manager is working through a dementia-related situation in their personal life, and they feel very connected to the message we're trying to bring. Anytime there's one of these connections, the business nearly always makes the time to participate in the training. In that, another unexpected challenge area for us has been working with grocery stores and restaurants. We've had a handful that have expressed interest, or that have had a training with just a handful of their staff, but they're unwilling to commit further. What we've been able to put together so far about this is that, having a lot of part-time staff really changes how a business owner thinks about the training. We've tried to be flexible. We've talked about just working with the full-time staff. We're trying to get creative with scheduling, but it's still been a pretty hard sell. I think another part has to do with the management of the business, too. We've had real challenges touching base and getting into the big corporately owned businesses as well. Every time I or one of my volunteers approaches a store manager, we get deferred to another manager, and then maybe another one, and end up kind of getting stuck. And so because of that, we've actually made the decision to focus most of our energies on locally owned businesses for now, and then see where recruitment takes us from there. And then that leads us into the second challenge, which is scheduling. Like I've been saying, throughout our time here together today, is that we've really learned to be as flexible as possible as we can with each business, because that's really what makes this possible for them. And no two businesses have the same preferences in terms of timing. So we started trying to do lunch hours, before work hours, after work hours, or there have been a handful of places that say, come in the middle of the afternoon. We promise we're slow then. And, they end up being crazy busy that day, and, we just work within that. But with that, being flexible for every single business means challenges in terms of our staff's availability to facilitate a training, and then helping volunteers know how to support the program as well. And volunteer involvement is an absolute blessing. We could not do anything that we do without volunteers. But it comes with its own challenges. We have roles for volunteers in recruitment, including going door to door, in data management, and in training facilitation. Having volunteers involved in the facilitation is challenging, and making sure everyone has a good baseline knowledge of dementia, as well as coordinating their availability with a business's time request. Currently, we are co-facilitating each volunteer-led training, making sure we have a staff member with them while that's happening. And through our recruiting volunteers, we've taken word of our training to over 70 additional organizations. And having this many organizations aware of our training leads back into that challenge of getting organizations committed and then scheduled. And our fourth challenge here is kind of a catch-22 situation. The purpose of the training is to increase awareness of dementia and how we need to consider individuals with dementia living in our community. But for business owners who have no personal connection, it can be really hard to relate to this idea. They might not see it as a problem they need to address, and therefore don't want to take time out of their staff members' days to participate. And then reaching rural areas has also been a bit of a challenge for us. Our county is split, as Mary said a couple of minutes ago, into a couple of distinct areas. We have a more urban and suburban southern part with a very rural northern portion of the county. And the majority of our partner organizations so far have been in this southern portion of the county, with a handful in these more rural areas. And we're really seeing how we can still address this challenge as well. And so I'm going to go ahead and turn it back over to Mary so that she can talk about some of our lessons learned.
Thanks, Marie. We have learned a lot, and we're happy to share these lessons with you. First and foremost is the importance of being flexible. Try things, listen to what each business suggests, but stay true to just a few major principles. Each organization has their own needs and limitations. There was one business, a pharmacy, that we actually trained while they were in the middle of sorting and filling their prescriptions. It sounds crazy, but they were able to multitask and take part in a great discussion. So you just never know what's going to work for the different business, and to stay flexible to allow it to happen. We do have two principles that we try not to waver on. One is that the business trains at least 50% of their public-facing staff to be recognized as a dementia-friendly partner, and that they designate at least 1 hour for each of the training sessions. We try to be accommodating in about every other way: time of day, number of training sessions, location, etc. But we've learned clearly that the discussion and conversation within the training session is the most valuable part of it. We have the information we give them. There is a didactic part, but really their learning comes from the discussion and conversation. People really learn from each other and the stories that their coworkers share. The environment is then right for a sort of brainstorming on what changes and accommodations each entity can make. This is another reason why we try to stick to this second principle. It's hard to have a good discussion-based training in less than an hour, and why we also prefer groups of about a dozen people. We have had a request to put this training online because it would be easier for the employees to take it that way, but we've chosen not to do that up to this point. We feel that the discussion is integral to the learning and the using process. Be aware of your trainer's needs and comfort levels. We've had a couple volunteers who were enthusiastic to get started and wanted to jump right into the training, but then realized that they were actually pretty anxious about leading the training once the time came. So we've learned to slow down, bringing volunteers on board. Now, after the initial training session with them, we start with co-leading several sessions. The volunteer can then take on as much as they're comfortable with, able to take on as much as they're comfortable to be able to do the whole thing. Another point here is for large organizations, we've had requests to do back-to-back trainings to get multiple staff groups trained on the same day. This may be a great option for the business, but it can be challenging to repeat the same presentation 2 or 3 times in a row. Some of you may have had that challenge before. So just be aware of what you're asking your volunteer presenters to do, and perhaps not ask them to conduct multiple trainings on the same day if that's difficult for them. It's sort of hard to remember what you've said to which group and keep it all straight. And recruitment is an ongoing challenge. Even when offering a free service, we've tried media advertising, going door to door, using social media, posting flyers and brochures. But as Marie said, nothing has seemed to work better than personal connections, like asking someone who knows the manager of the store or restaurant to make the first approach. Although participating in this initiative is free, in quotes, there is a cost to the business for their employees' time in the training session. This personal approach often works to get past this potential barrier where a cold call may not get you in the door. This is our last slide. We've shared pretty much all that we know with you about becoming a dementia-capable, dementia-friendly community. We've shared our challenges and the lessons that we've learned. So what's next for us? What are we wanting to do? Well, first up, we are excited to have been contacted by the Chapel Hill Transit to provide training to all of their fixed route bus drivers. I think Marie mentioned that there'll be 160 of them that will be training this summer over 8 sessions. We had already trained their paratransit drivers last summer, but now they want all their drivers trained. We're really thrilled. We also have several more banks that are lined up for training this summer. We're also beginning to collaborate more with organizations beyond our county limits. We have had training requests from several other organizations wanting to start their own dementia-friendly business campaign. We're always happy to share what we know and also learn from their process. We want to reach out more to police and sheriff departments to make sure that all our emergency personnel have the information that they need to deal effectively with persons with dementia. And as recruiting is always a challenge, we want to keep coming up with new recruiting methods, especially those that rely on a personal contact. Our new idea is to ask our local CCRCs, or continuous care retirement communities, to help. The heads of 2 of our CCRCs have agreed to send out letters to the businesses in their nearby neighborhoods, recommending that they become a dementia-friendly partner. We're optimistic about this strategy and hope that it will bring in some new businesses, like a movie theater, a coffee shop, and some grocery stores that cater to the older residents that live in those communities. And finally, we hope to grow our volunteer base and have them involved with all aspects of the recruiting, scheduling, and training process. The hope is that one day this whole program will be managed by a set of dedicated volunteers. This is our sustainability strategy for this program once our grant funding is gone. We think that with proper training and support up front, that this is entirely possible. And this brings us to the end of our webinar. Here is our contact information for both Marie and myself, our website, and our Facebook addresses. We're most willing to share our materials, which are available on those sites. But now I think that maybe there's time for some questions. And please ask any questions you have about anything that we've talked about today. Sarah, I think we turn this over to you now.
Great. Thanks, Mary. Thanks, Marie. That's a great presentation. We did have some questions come in while you were speaking, so I'll start going through those. But if others have questions, please feel free to submit those, and we'll get to as many as we can. So can you, one of the questions that came up a few times, some people were asking, they know that there's some other programs out there, Purple Angel, Dementia Friendly America. Can you talk a little bit about why you chose to design your own program as opposed to using one of those?
I think that we weren't entirely aware of the Dementia Friendly America when we got started and all the wonderful tools that they do have available now. It was just sort of a homegrown program. The person on our board was familiar with some of the things that had been done in Europe, and we patterned it after that. So that was really why. I think that when we really started talking about this, it was mostly we weren't aware of everything that's available now.
Okay, great. So I know you touched a lot on the criteria you use for a business to get trained and use the dementia-friendly icon. Can you talk a little bit, though, about how you, if you have a process for recertifying businesses to ensure that they remain dementia-friendly given staff turnover and other, changes in leadership and other changes in businesses?
Absolutely, and we're still a pretty new program, so we're still kind of developing that as we go along. The partnership does last for 2 years, so on everybody's stickers it does have like a 2-year marker on there. At the 1-year mark, we're in touch with each of the businesses, just kind of a check-in, see how they're doing, see what questions they have. And we do ask about new staff and if we need to come back in at that point in time, but it's not a requirement. And so at this 2-year mark, we're planning on being in touch with each of the businesses and just requesting that we come back in and do a follow-up training with definitely any new staff that they have, and hopefully also including any other staff who want a refresher in the information as well.
Great, thank you. We had a few people ask for a little additional explanation about the difference that you see between dementia, or the slight differentiation maybe between dementia-capable versus dementia-friendly communities.
We don't dwell on that, honestly. We want to be both. We want to do it all. We are also an age-friendly community in Orange County, and we don't worry too much about the labels. I know that there are specific movements that are capturing one or the other. We want to be members of it all. I think that there are a lot of overlaps, and there are some distinctions between the two, but we don't really want to necessarily say we're one or the other, that we're really both. And we just don't worry too much about the distinction.
Okay.
Definition-wise, and you can correct me if I'm wrong here, Mary, I'm pretty sure definition-wise dementia-capable has to do with a little bit more of the service arm of things, whereas dementia-friendliness has a little bit more to do with attitudes and awareness in a very tiny nutshell. Oversimplified, but for a general explanation, I'm pretty sure that's where the difference is. But like Mary said, we try and cover all of our bases.
Okay. We had a few questions also come in about any elder care or health and wellness partners. Do you have any partners you can talk about that are residential facilities or provide long-term care?
We actually started out targeting non-aging community services because they didn't have any supports or any knowledge about being dementia-friendly or being welcoming and understanding of people with dementia. And we felt like many of the aging network should already have this capacity. We recognize that there is a great need for folks with particularly direct care workers who are hands-on with people that would benefit from additional training in communication and how to engage people appropriately. And that's the focus of our provider level training that we're doing. But we expect all of our long-term care facilities to be dementia-friendly in terms of being welcoming and inclusive of people with dementia in their facilities. But they're not part of our dementia-friendly target as much as part of our training target as another part of our grant project.
Okay, great. Thank you. Another question came in if you're aware of any other units throughout North Carolina, since you're a county unit. Are there any other similar programs in other counties in North Carolina, or do you know of any other states that are doing similar work with businesses?
I know within North Carolina we've had connections with a group out of Wake Forest. We've touched base with a group in Cary. There's a group in Western North Carolina, I think Durham as well. Off the top of my head, that's who I can think of at the moment that are definitely trying to get programming going that we've collaborated with outside of county lines. Beyond the state, I'm not really sure at the moment. Do you know, Mary?
We've had a conversation with some folks in Florida that are working on this, I think in the Orlando area.
Citrus County, wherever Citrus County is. Yeah.
Okay, great. Thanks. Can you talk a little bit about how much staff time is dedicated to the program, and then how much of that staff time is used training volunteers, like what kind of process that is to train all the volunteers, and then what kind of admin and other time the staff use?
I was going to say absolutely. So I'm the official coordinator for the program, and I mean, this is just one of the many assignments I have here at the Department on Aging. I'd say there's some weeks that this is a half-time commitment, and other weeks that it's not quite that much. It really kind of depends on the ebb and flow of how many trainings we have scheduled and what kind of interest we're seeing in any given week. And then there are a few other staff members who will help out with a training, here and there as needed, depending on our facilitation needs. In terms of volunteer training, our volunteer orientation consists of really just a conversation about what the organization looks like, what our goals are, and trying to understand what level of dementia knowledge this volunteer has. We are lucky enough to have several individuals who are already working or retired from the aging field, and they do have just a wonderful wealth of knowledge that they want to bring to this area. And so that's really helped in terms of the volunteer orientation process. For other volunteers, we do have another education series that I think Mary mentioned earlier for families and interested community members. So we encourage any interested volunteers who don't have that background and knowledge in dementia to go through that series just so that they gain that little bit of extra knowledge. And then after that initial conversation or training, it's really just a mentorship process through the facilitation or through the recruitment, whatever their area of interest might be. And so I normally take that on as, I know just a few weeks ago, before it got too hot here, a volunteer and I went out door to door along one of the main streets in Chapel Hill, just talking to local businesses, trying to talk to managers, and trying to get the word out about what the program is. And then we normally request that volunteers interested in facilitation, they come observe 1, 2, 5 training sessions, depending on what their comfort level is, and then that we start co-facilitating together to, bolster their comfort level with the material and how they feel about answering questions along the way.
I wanted to mention that when we started, I think I said that we were approached by really a volunteer. We were approached by a member of our advisory board who was a member of the Rotary and wanted to get this started. And this was before we had the wonderful resource of our ADI grant. And we really envisioned this being something that volunteers would be doing. And we had, because we do have the University of North Carolina in our backyard, we had a social work intern that helped us develop the initial training video and put together an outline of the volunteer training. And that's our sustainability plan as well, that once the grant is over, we hope that we will have trained a group of volunteers who actually can do all of the pieces of this with support and supervision from our volunteer program. We have a whole separate unit within the Department on Aging that provides support to volunteers, so this would just go into that sector, and we hope that we can keep it going at that point.
Great, thank you. A few people have asked if you've received any feedback from consumers, both people who may have dementia or their caregivers. Have they noticed a difference in the way that the business is operating or how things go once they're at the business? Can you talk a little bit about any feedback you've received?
We've only gotten a little bit of feedback from families themselves, actually, and it's really all been positive. Just most of it's been anecdotal feedback from a family to a business, and the business reports to us. But the businesses do say that, they've been thanks for having the sticker up. They've been, received appreciation from their customers coming in for, showing they care and showing they're part of this community.
Okay, great. Thank you. Let's see. A few people have asked if you have your materials that you use in your presentations for the businesses available for others to see and possibly use. I know you said you're willing to share. Is there a way for folks to get those? Should they email you directly?
Yeah, you can just, if anybody's interested, you can just shoot me an email and I can send you a PDF version of the materials we use.
Okay, great.
And like I said, our training video is available on the website too, which I think the link was up. And, where we just kind of created that out of thin air, so anybody's welcome to borrow that as well.
Great, thank you. When you are, a few people are asking about how you actually do the recruitment with businesses. Like, what approach are you using to get folks interested in this project, and what's kind of the selling point that you provide?
I think that depends on who you ask and who it is that's speaking individually to each business. I know our partner at the Rotary, Lorenzo, he has a very business-focused recruitment method when he goes in. He goes and talks in about, like, the numbers and the style and the clientele base. It's a very, for me, not being in the business world, it's a fascinating approach that seems to work in some situations. My approach tends to be more talking to, first, another learning point learning point from this is that it is best to be in touch with a manager or an owner, just going in and talking to whoever's at the cash register or whoever's, serving tables or that kind of thing doesn't get you very far because they just pass you along. But talking to the owner or the manager, I really try to, make a personal connection with them somehow, just go in, take a couple minutes of their time, just to understand, if thinking about older adults in our community first off is something they're considering, and then from that, seeing if they have any interest in, the world of dementia, and if they have, any awareness in terms of how challenging that can be for members of our community right now. And then from that, I just let them know it's a free training, we can come to you, we make it as easy as we can, and that's been my method so far, and we've had pretty good results with that.
Great, thank you.
One other point on that, we developed some brochures, sort of recruitment brochures about benefits about being a dementia-friendly business and what it takes and all that. And we, every meeting that we go to, we take those brochures along, and the people who are in the meeting, we ask them to leave one of these brochures with the places that they do business, to make a suggestion to the manager. So it's the approach varies by the relationship, perhaps, with the person to whoever the manager or owner is of that business. And sometimes it's, as Marie said, it's very personal, and sometimes it's based on a business sort of approach. But we don't do all the recruitment ourselves. We really put these brochures in as many people's hands as we can and ask them to talk to the places where they shop and where they watch a movie or whatever, and try to promote it that way.
Great, thank you. So, interesting question came in. What do you feel is the greatest asset of your program? What makes you different that gets people interested and excited about the work you're doing?
One thing I keep hearing over and over again among a couple of our staff members here, and I don't know if this quite answers the question, is that people are excited because this Dementia Friendly Business campaign doesn't sit alone. It's part of a network of services, for all, as many, families in our community as we can serve who are living with dementia, and then, it's also a providing, services within the Department on Aging for all older adults in general. And I know one of my colleagues just keeps going on and on about how, she loves the fact that we have complete wraparound support for the families living with dementia in our community, and how that, she believes, sets us apart from other organizations she's seen.
So maybe you're saying that it's a dementia-friendly business, which is part of a dementia-capable system, that it's supported through that array of services and supports that are part of the program.
And an example from that, I know we just finished a whole, bunch of trainings with our local Wells Fargo banks, and I think it was actually through ACL we got that referral, so thank you guys for that one. But we were talking with, each of those Wells Fargo banks about, they were concerned about, somebody's coming in and they're confused and what do we do? And, so we can then, on the flip side of that, help support the bank as they're learning to work with these families who are going through these challenges. So it's, we're not operating in isolation. We have answers when the businesses come back to us and say, oh my goodness, this is happening, what do we do? We have resources we can loop them into.
Great, thank you. So we just have a few more minutes left. A few people have asked a little bit about how you're evaluating the program and outcomes. Can you just touch on that a little bit?
Yes, so we have a one-year follow-up survey that we send out to the dementia champion or our contact person in each of the businesses. And that one-year follow-up, forgive me if I don't remember all of the questions right now, but it's just asking information about, have you used this information, was this helpful to you? And then we also loop back to those goals that we asked the organization for, when we first did that initial training. So we ask about each of those goals, if it's something that's still important to them, if it's something they've started making steps towards, what's helping them make those steps or what's hindering those steps, and how we can help facilitate that process along the way.
So it's kind of a single subject design in that each business identifies what they want, what changes they want to make to become more accommodating or more welcoming, and then go back and see if they were actually able to do those things or what extra help they needed to be able to have success.
Great, thank you. So we've reached pretty much the end of our time. I just wanted to remind everyone that we will have another webinar next month on August 8th about advanced directives. So we hope you can join us for that. And I want to give a big thank you to Mary and Marie for your excellent presentation and responses to questions today. We didn't get to all of the questions, but we did get to many of them. So thanks everyone for your participation in that part of the session as well.